A 45-year-old teacher came to me 6 months ago. She had been told she needed spinal fusion surgery and was absolutely terrified. She couldn't stand for more than 10 minutes. She was considering quitting her job. Today, she is back in her classroom teaching full time without ever having had a surgery. This is exactly what we did instead. ये वीडियो आज आपको एक unnecessary spine surgery से बचा सकती है. Hi, I am Dr. Jayesh, a spine surgeon, and I perform fusion surgeries. But I also believe that a good surgeon's job is to exhaust every possible option before putting someone on an operating table. And in most cases, there are more options than patients realize. In this video, I'm going to walk you through exactly what we did for this patient. The same approach I use for most of my fusion candidates, so you may understand what is possible before you make any decision about surgery. When she came to me, she was in a significant pain. Her lower back was constantly aching, the pain was shooting down her legs. Standing in front of her class for even a short time had become impossible. Her previous doctor had looked at her MRI and recommended fusion surgery. And now, looking at the same MRI, I understood why. She had a condition called Spondylolisthesis. One of her spine bones had slipped forward over the other bone below, making her spine unstable and compressing the nerve running down her leg. But here is what I noticed. Her slip was moderate, not severe. The bone had shifted, but not dramatically. And her muscles, though weak, were not gone. That told me her spine still had ability to be stabilized another way. We started without surgery. Here is the exact plan we followed. First, we controlled the pain. She was in too much pain to do anything. So we gave her targeted epidural steroid injection directly into the inflamed nerve. Within a week, the shooting pain in her leg had reduced significantly. She could finally sleep through the night. Second, we built her spine's natural support system. Once the pain was manageable, we started her on a very specific physiotherapy program, not generic exercises, targeted core strengthening, building the muscle that act as a natural belt around her spine. These muscles do the job the surgery would have done. They stabilize the bone and stop it from slipping any further. Third, we changed how she moved. So we identified the specific movements that were putting pressure on her slipped bone. Certain ways of bending, lifting and standing, small adjustments to how she moved through her day made an enormous difference to her pain levels. 6 months later, she walked into my clinic smiling, back to work, no surgery. So when is fusion actually necessary? I want to be honest here because fusion surgery is sometimes genuinely the right answer. If the bone has slipped severely and is causing significant nerve compression that is getting worse every week, non-surgical treatment will not be enough. If you are developing weakness in your legs, foot drop, or losing bladder control, that nerve needs to be decompressed surgically and quickly. And if you have tried a proper course of physiotherapy and injection for at least 3 to 6 months with no improvement, surgery becomes the necessary next step. But if none of those apply to you yet, you likely have options worth exploring first. That teacher did not avoid surgery because she was lucky. She avoided it because we caught her condition at the right stage and gave her body the right tools to stabilize itself. If you have been told you need fusion surgery before you agree, ask your surgeon these 2 questions. Have we tried all non-surgical options first? And is my slip severe enough that surgery cannot wait? Their answers will tell you everything you need to know. If you are dealing with a slipped vertebra or you have been told you need fusion, book a consultation this week. Come with your MRI, come with all your questions, and let's find out together whether surgery is truly your only option.